Hello, everyone, and welcome to the SavvyCast. This is Jamie, and I'm so grateful that you're here. To all of you watching or listening, today is going to be a very special treat for those of us who love animals. That would be me, as anyone who knows me knows they're near and dear to my heart. So I would like to introduce to the SavvyCast Dr. Leigh Stevens. She is going to share so much information that I personally had never heard. I did not know all of these wonderful things existed. So anyway, Leigh, welcome to the SavvyCast. Thank you for taking time from your busy schedule to be here.
Oh, thank you so much, Jamie. I really appreciate it.
Well, Leigh, I just want to start by asking you what you would choose for your last meal. That's my icebreaker question for everyone.
Sure. That's a great one, actually. So I think for my last meal, with COVID and everything, we've eaten home a lot. And, actually that's become my favorite place sometimes.
Yep.
So if I had to have a favorite meal, my husband has perfected his steak. So the steak with the umami coffee rub, I think would be like my top choice. And then probably he's been mastering his bread baking. So it would probably be some homemade focaccia and, roasted broccoli with all kinds of lovely seasonings on it. And maybe an ice cream sundae for dessert.
Oh my goodness. Okay. I have got to say, I'm super impressed. And let me just tell everyone how I even came to know you. Your husband, Tim, I met him at my husband Zane's big event. It's a yearly event, Silicon Y'all, where people from all over, even outside the United States, come for just this big event. And when Tim told me what you did, I said, would you please ask her if she would be on my podcast? And you're so kind. And anyway, he's delightful and you're delightful. So let me just jump in. Can you you're beyond a veterinary doctor of veterinary medicine. Can you just encapsulate what you do and before we dive in?
I am one of those people who's I'm going to describe myself as a well-rounded person because I do a little bit of everything and none of it exceptionally well, but all of it at like that B+ A- level. So it starts out as I am one of those lifelong learners. So I have done everything from, I have a 3rd degree black belt in Taekwondo because my kids were, hey, that looks kind of interesting. And I thought, bet I could do that.
Wow.
And then my kids also were in a parent participation preschool and then elementary school. And then I discovered, I kind of like this teaching thing. Why is that? I don't have a teaching background. So, but again, being lifelong learner, it was just learning about a new species. It was just the infant of the human species, which was a new thing. So I kind of taught myself about that and then found myself teaching and enjoying making science lessons that include things like how do you use food to teach science or food to teach literature. And so it supplemented the kids' education and the state standards. So I would look at the state standards and go, oh, they need to learn about, let's see, electricity and magnetism. How can we make circuits using food? And it was a way to get the kids really engaged and also for me to be creative and have fun. So that's kind of one side of me. And then again, I have always loved animals. So and I guess my kids function as baby animals. So, it all worked out well.
Yeah.
And so I've always loved animals. So when I was, I guess like in 4th grade, a friend of mine said, oh, I want to be an animal doctor. And I was like, you can do that? So that started my long pathway and journey to becoming a veterinarian. And I worked in a general practice for about 9 years. That included 2 years in a strictly cat practice. And then the rest of the years in a kind of a regular dog and cat pocket pets. So it was small animals
Uh-huh.
practice. And I did a couple years of managing in there. And I was like, yeah, I'm not really in the management track. I'd rather be a doctor. And then when the kids were kind of little, I backed away and kind of started doing the semi-retirement, which wasn't really retirement. It just meant I was tracking into other things like preschool and elementary school. But along the way, kind of was introduced to a place that did physical therapy for animals. So for me, it was really cool because I'm like, they do that.
And you're
And
referring specifically, correct me if I'm wrong, to Scout's house.
I am, yes. And so, yeah, go ahead.
Was that new? Was physical therapy at the time like on cutting edge, or was it just you just didn't know about it?
No, it was cutting edge. I mean, it was
Okay.
like when I was going to veterinary school, there were still people that were debating whether animals felt pain. And so sometimes animals would have surgeries and it would be like, well, if we gave them pain meds, they might feel too good and be too active. Well, that idea has completely been flown out. I mean, it's been thrown out the window. It's been discovered that small creatures, even though they can't talk, definitely feel pain, but there was still some question as to whether pain was perceived. And so if you didn't perceive the pain and you couldn't talk about it, then maybe it didn't exist. So long story short, Scouts House was started by a gal who knew more about physical therapy than I did. I'd never had physical therapy, so I didn't understand the benefits of it. But again, I was kind of called up. Somebody said, hey, you were recommended as somebody who filled in. We need somebody to fill in for a day. And it's just one day a week. This doctor's going on vacation. So I started working there. And after a while, they're like, we really like you. We're going to hire you.
So,
It was
Leigh,
yeah.
did you when you filled in and then you kept working, were you actually performing physical therapy, or were you meeting like veterinary needs on the
Yeah. So I work with a person who she is a physical therapist. She's done a lot of kind of geriatric stuff,
for people?
but for people. But then she had already transferred into working with animals. So she's been doing this many more years than I have, and she's, super, super well qualified. Amazingly probably for people, but then has applied it all towards animals. And so when I came in, she'd already been doing it for any number of years, but it was physical therapy was never even mentioned in my vet school curriculum. So keep in mind, it was probably, I had graduated and I had been out of school like 12 years. So a lot can change in 12 years. And so at that point, then there were again some people who were starting to do physical therapy in animals. And so when the first time they called me, they said, we're just going to have you work for a day and fill in. And, we'll pay you X rate. And I laughed because I'm like, well, I should be paying you because I honestly don't know anything about this. And they're like, all we need you to do is do a physical exam, read the records, and tell us if this patient is a good candidate. We really just need you to make sure that this animal is medically
In need?
in need of this, and if it's indicated, and then we can go ahead and proceed. So I work with a physical therapist and an RVT or registered veterinary technician, and they do the physical therapy treatments. The physical therapist writes out the treatment plan. Because as I've been doing this, I've discovered that my education was very different than a physical therapist's education. They're very different programs. So, and they focus on very, very different things. And so,
Well, Leigh, I have a question. My
yeah,
son-in-law is a physical therapist. The physical therapists that the ones that you work with, or even physical therapists for dogs in general, are they just physical therapists who train for humans who then apply that to dogs, or is there a subspecialty?
there's a sort of, it's not really so physical therapists themselves are kind of like, yeah, there's the animal thing, but we don't really do that. So PT is like the registered name for doing it in humans. So there are subspecialties for people who are interested, and not necessarily, there are veterinarians who will do some of these subspecialty things as well that are kind of training courses in physical rehabilitation. So only the physical therapists can call themselves physical therapists, and physical therapists aren't necessarily it doesn't really get applied to animals officially right now. But then the people who have gone and done everything in the animal field have actually done certification for, there's a couple different programs that are in the United States that they can go and take this extra certification and
Oh,
then start working with animals.
so it would be if someone who's listening is interested in doing physical therapy for animals, learning how to do that, they would not go through a physical therapy course. They would really take more veterinary programs with or could they just get a certification in physical therapy for animals without becoming an actual doctor of veterinary medicine, which is very hard to get.
Yeah, not at this time. At this time, my understanding would be that you can't just, as a layperson, go into one of these programs.
Okay.
So it needs to be, a physical therapist going into it or a veterinarian going into it. And then they do have some levels where registered veterinary technicians can go ahead and, learn the skills as well. But they're not necessarily like writing out the treatment plans necessarily. There may be some who do that, but it's still kind of very gray area in terms of licensure and how it's all been. And again, every single state is different, so that's why I'm not knowledgeable about it. Is because
and that was leading me to my next question, because I know physical therapy for humans. I mean, you certainly have to use insurance to pay for that. Now you're in California, we're in Alabama. I know every state is different, but have you found that some pet insurance companies will pay for physical therapy for dogs?
There's some, and it changes. So it varies from what I've been able to tell. There are a few that will cover it or did cover it, but then they don't. It's almost like something you have to check on a month-to-month basis and see if your pet insurance is covering it, is still covering it, or has added it in. And in some cases, it depends on like what level you have kind of paid into the program. So the kind of plan you have, whether it's a bare bone plans or whether it's more the premium plans. But I have seen it covered by pet insurance companies. Most of the time it comes, out of people's pocket.
So just like the daycare where my dog is today. When you like Mother's Day out, all of that, that's just part of it for a lot of us. Well, okay. So the place in California where you do the physical therapy that you're involved in, that is Scout's House. Okay. Can you just give some examples of some of the little animals? And it's small animals. It's not like horses or large, or is it?
Well, it's not horses, but we've had certainly some 165-pound dogs come in. So they're bordering on small horse.
Oh my
God. But yeah, I mean, so our practice, when you work with dogs, you see those that weigh like 5 pounds, like in some cases, little tiny guys, and we'll see puppies if it's more of a congenital thing, all the way up to, giant breed dogs. So it runs the gamut.
Is it mostly dogs though that come? And is there one problem that is just the predominant problem that would bring a patient to you?
It's a mix. I would say, there's two things, and it kind of depends on the age level or the age, the age group. So if it is, we will see some animals who have, say, some congenital issues. That's less common. The most frequent thing that we'll see is dogs with knee problems. So in small dogs, it might be small dogs who have a kind of the kneecap or their patella that isn't going and tracking in the right spot. And so in some cases causes knee pain. So we will see little dogs with that. As they get into a bigger weight range, we will see, think of your active lab who tears a cruciate ligament, or, we'll call it, veterinarians call it a cranial cruciate ligament. Humans, it would be an ACL. That's a pretty common injury. So in some cases, we'll see some where it's maybe strained a little bit and they just are trying to avoid surgery. Or we will see the post-surgical dogs where it's like, all right, my dog chases squirrels. Let's get them rehabbed as soon as possible, so the other side doesn't need surgery too. So we will definitely see that. And then we also see a large number of older geriatric dogs. So these are cases where we'll have 14 to 16-year-old dog who otherwise, is still pretty with it mentally,
Yeah.
and is starting to have some physical changes that make it harder for them to get around. And, their pet parent says, gosh, I just want them to have the best quality of life as possible. And while they're here, most of those dogs, not all, but many of them, will recommend that we start getting into what's called multimodal therapy, which means we'll do a lot of different things, physical therapy being one of them, weight loss, recommending weight loss is another, different pain modalities like low-level laser or a pulsed electromagnetic field therapy bed. And most of them, I like to have them be on like non-steroidal anti-inflammatories or something like gabapentin, those type of pain medications, because a lot of times that will be the first thing that a veterinarian will script, and they'll, give somebody a prescription for medication and they go home and that works great for a little while, but then they get to a point where it's not enough. And so that's where, to me, it's kind of rewarding to be able to go, guess what? We have something beyond just the pills. We can offer kind of a strengthening plan. We can offer a plan that helps with decreasing inflammation and making them feel better and move better. But again, doing a lot of little tiny treatments that actually make a dog generally be much healthier for a whole. So I those are the ones I find the most heartwarming, because those are the ones where oftentimes as I'm reading through the record, I will see the, discussion about euthanasia. And so then Sea Scout's house. Those are always kind of some of my favorites, because in a lot of cases we're like, no, your dog hasn't checked out yet. You don't have to just put them to sleep because they've turned 13. They have some life left in them. They still want to be with your family. They still want to be part of your life. So it's so nice to be able to offer them another like option, and also be able to kind of support them as they, kind of go on into their twilight years.
Well, that is very interesting. As about the ages that you're mentioning. I have a friend. I still have a hard time. She has a dog who's 22.
Wow, that is. I think that's probably got to be the Guinness Book of World Records. She should check into that.
She laughs. We laugh. She's just adorable. She's a very good organizer. So she helped me organize all of our closets. So we talked. We had long chats, and she said her dog is 22. And he is little and runs around like he's, 6. But she said, at some point, I've been telling them, at some point we've got to say, go peacefully into the night. But at 22, I can understand that will happen pretty quickly. But how do you determine, let's say one of the older patients that you have and the family is thinking euthanasia, how do you determine, in your opinion, when that should be on the table, when there's pain involved and it's a quality of life for the animal?
You've hit the nail on the head. And so as far as I'm concerned, there's no timeline. I have had cases in the past that broke my heart where somebody would say, there's a timeline, as soon as they turn X, they're gone. And I can't, I had an 18-year-old dachshund. I personally, I don't believe in that philosophy, so to speak.
Yeah.
So for me, it's, you go by quality of life. I oftentimes counsel people, it's like, so, depending on what it is, if it is an old age thing, everybody has to have a good quality of life, including the pet parent. So if we have an animal who is, say, still engaged, even if they can't hear and they can barely see, if they're still engaged and, using their other senses to, find the family, and they're still wanting to be social. And, I've had patients that have been paralyzed for years and years and years, or that are incontinent, and that's okay, because they're engaged and their family is invested in them. And, they have a special needs pet. They know they have opted into having a special needs pet. And for them, that's what life is. The dog doesn't know there's anything wrong with them. The people are like, we can deal with this. This is, manageable, but we just want to have that relationship with our pet. And the human animal bond can be very strong. And I have had a human animal bond with a stick bug. So it really doesn't have to be something with 4 legs. It can be, you can become fond of whatever it is. The brain just does what it does. And I can't fight it.
Right.
So, and I
Well,
can't judge either.
when you
But
have those cases, because I can tell you're very compassionate, when you have cases where there's someone who wants to keep going and as a medical professional with all that is available, that it's time, how do you handle do you make that call with them, or do you?
I discuss it with them. I like to be open and kind of say, two things. So one of which is because people have a lot of guilt over their decision, and it can be many, many years. So I like them to go into it as guilt-free as possible. So a lot of times I like to tell people, so if this is getting too much to handle and you are beginning to either resent your animal or there's any negative feelings towards the animal, it's totally fine to say goodbye. So there's that aspect where, if it becomes that it's too much of a burden. I mean, when our shepherd mix had to be put down, I had a 10-month-old and a 4-year-old, and it was just like, okay, you have cancer, your time is limited. And it was kind of like, okay, now it's time to say goodbye. And I'm okay with that. I had, realized that there was only so much I could handle at one time and keep my sanity and everybody happy. So I was like, you know what, it's okay to say goodbye. The other thing is that, when it comes down to an animal where you're like, they're not here right now. When it comes to a case where an animal is pretty much fully checked out, we will have somewhere that people will come in, they're like, we want you to fix them. And I'm like, we don't do miracles. So your dog is laying there, hasn't once kind of tried to figure out where we are, isn't trying to get up. It's okay to say goodbye now. So I try and counsel people that, I know it's hard to let go, but also it comes down to, it's almost like a humane thing to do, or it's a gift. To me, it is a gift that I can offer to the patient, because one of the, and again, hindsight is always 2020. You have those people who think they did it too soon, but you also have those people who say, God, I waited way too long. So I try and allow people to know that there's a happy medium. It's never happy. It's a sad medium maybe, but there is a balance between when it's the right time and when you're like, okay, maybe now's a little early. So I like to talk to people and, just have that conversation. Because again, sometimes we've had some too, where, so those were the ones that made me smile, where the people were like, my dog's not able to walk. There's something, this case in particular was a very large, I think, giant schnauzer, again, one of those 150 pound, and they're like, we can't move our dog. And, this is getting to be an issue. And again, the physical therapist, when I did my exam, she did her exam, and she's like, oh, wait, the hips are not there's a cranial rotation or a frontward rotation of the hip bones. So where your pelvis is supposed to be kind of level, which doesn't necessarily show in Zoom.
Yeah.
There was, imagine an asymmetry. And the physical therapist was able to do a treatment and get
Like
that
an
dog to the
adjustment?
point. Yeah, basically a joint manipulation. And so, or joint mobilization. So she was able to do that on this large dog, who then was able to get up and walk. And it was like, you could see the owners were like, wait, what? So it was really to me, that was wonderful, because it was like, okay, there was something we could fix. And that was basically what was going to be the demise for the dog. So I was like, oh, yay. So those are always very heartwarming for me.
Oh, okay. Now, if I were somewhere here, now we have a fabulous, Auburn University is a fabulous vet school, and you can take your animals there. So maybe there, but at a normal veterinarian's office, would that dog have probably had that outcome? Would a typical, so
and again, as a veterinarian, I was never trained like to look to see if the hips were level and if things matched up. That wasn't the way I was trained. And it's a very subtle thing. Maybe an orthopedic surgeon would pick it up, maybe, but only probably if they talked to somebody who was in physical rehab, who knew to look for it, and knew the clinical signs.
Well, do you happen to know how people would find a physical therapist for their pet in their state? Because just the story you just told was so life-changing.
Yeah.
When most dogs would be probably euthanized or.
Yeah. I'm trying to think, I know I've seen it and I don't know where it was. There are a lot of times, if you look up like physical rehabilitation or physical therapy for animals, and I can't tell you where it is because I saw it like a couple years ago, but I'm pretty sure there are definitely websites that will tell you people. So there's the Canine Rehabilitation Institute, CCRI, they probably have a listing of people on their states. Another thing would be to check with their regular veterinarian and see if the regular veterinarian is knowledgeable about places nearby as well. But there are probably listings of, veterinary, not even in some cases, there are physical therapists that are running their own practice. It just depends on what the regulations are for the state. But a lot of times they can look up either physical rehabilitation, which is what you can call it if you're not a physical therapist, or physical therapy for animals. And they hopefully would be able to find the resources just by doing an internet search. And then again, add your state in there, and that would target it more directly too.
Okay. Well, I wanted to ask you about disaster preparedness, because does every person with a pet need a disaster preparedness plan, or is that explain that?
Yeah. So I was involved with disaster preparedness for quite a number of years, and learned quite a bit. So in the process, it really depends on the types of disasters that you will have in your area. So if you are likely to need to evacuate because of a hurricane or a tornado, or if there's an earthquake or fires. So just knowing, or flooding, just knowing what your local risks would be in your area. I think it's always really important to have at least some preparedness plan for people, which of course is impossible, but then including, if you already have a disaster preparedness kit for yourself, just to throw in something like, the extra leash, maybe, some canned food. The dry, may or may not work, but at least the canned food should last for a long time. And again, if an animal is going somewhere, it's going to be scared. Give them the special treatment, because they may be kind of flipped out. So you want them to have really,
their heartworm
definitely
medicine.
Yes, they're exactly. If you're in an area where you need heartworm medication, if they have any regular medications that they take, like pain medication, or those are the type of things to bring. It wouldn't hurt to have, I'm trying to think of places where, if you were having to evacuate and say go to a hotel, they don't have dog bowls. So it might be worth having at least some extra sets of, even just plastic bowls, but something that you have so you can serve your dog food and water. If you have a cat, we did have the founder of Scouts House had to evacuate with the fires a couple of years ago, and said that was very difficult because she had kitty cats that she had to, evacuate into their carriers, and they ended up staying in their carriers a long time. And again, trying to put together a litter box, in a hotel with cat litter and things like that, it's really useful to have that. But then I think more importantly, and again, this is probably more of a COVID thing than anything, is that for all the people who have kind of the COVID puppies that weren't necessarily well socialized, it's probably a good idea to just think about, will I need to evacuate somewhere, and how does my animal act, with different situations, and also different people and places where it might be very crowded with other animals, at least to start thinking about that. The other thing is, if somebody has a cat, really starting to, get them a common, don't just pull the cat carrier out once a year when they go to get their vaccines and their annual checkup. I think it's super, super important that cats learn to use their cat carrier almost like a little dog house. If you think about their little retreat that they can go to where it's quiet. So I was able to train my daughter's kitty to this was because I knew he was going to have to fly to Florida, but I'm like, if he comes home and visits us in California, then you're going to have to take him on the plane. So, I started by just having the carrier open for him to investigate. And then every time I gave him treats inside the carrier, so that he learned to associate the carrier with a really good space where he got treats. So
would you suggest that all of us, like I have a golden doodle who's 75 pounds. He's a big boy.
Yes.
And I haven't been putting him in his crate. he just goes into the laundry room at night because I wanted him to have space. But when I thought that he was going to go to school for obedience, they
Mhm.
said, well, he'll be in a crate. Is he crate trained? And I said, well, no. So I see what you're saying, that for many reasons, your animal needs to love the crate or the cat box, because at some point, whether it's a disaster or a trip, they need to not be afraid of it.
Yeah. Yeah. And we have, believe it or not, we have two bunnies. The
Mm.
bunnies are crate trained. So, in their case, it means, oh, we're going to sit on, we're going to sit on somebody's lap and somebody's going to pet us for the next hour while we're driving somewhere.
Mhm.
But, it is just for that, especially for emergency purposes. I've certainly seen it now that we've seen more, animals that have had surgeries. It is really useful to know that they can be crate trained and not injure themselves or not
Mhm.
panic when they're in a small space. It also, depending on, if people have a kind of crazy, with COVID, it was, again, a lot of people got COVID puppies. They were working from home, then they need to go somewhere. I've had people who were like, I have to bring my dog to the grocery store because I can't leave them in my car because they're going to tear apart my car because they've never learned to be by themselves.
Right.
So I think
Mhm.
it's good just to get them used, it's like,
Right.
okay, COVID was a special situation, but just having them, I think, so the crate training is easy to train. It's just make it that kind of, yes, it means you have to keep it out. And if you have a small place, it can be a challenge,
Just leave the
but
door
having
open,
that, leave the door
treat.
open, and every time, yeah, either give them treats or even just feeding them, giving them their meal inside their crate allows them to kind of develop that, oh, there's good stuff,
Yeah.
or, and sometimes it's the, if they're not following you around, I've done the, I'm just going to throw some treats in for you to find them. So it
Yeah.
becomes the, oh, surprise, I get treat space. So they'll
Yeah.
just kind of go in and check it out. And
Right.
then once they get used to kind of getting the idea of, and you have to do it, you have to gradually introduce the, okay, this is the space where you get really good treats. And then the closing the door. Because again, closing the door or zipping the carrier and the cat carrier closed, they're like, wait, this is different. Again, you're throwing treats in, and then you open the door after a couple seconds and you're like, see, no big deal. And then you gradually increase how long the door is closed.
Mhm.
If there's any time where they're like, okay, now I'm panicked, then you're like, okay, take a step back. We'll just close the door for, say, 1 minute. If they've gotten to the point where you got up to 5 minutes, they started to panic. All right, we'll go back to like 1 minute for a couple times, and then keep rewarding them. And then you can go ahead and increase it. Maybe eventually there's some they'll figure it out. They're like, oh, this is a cushy place I can take a nap. But at least then when you get to the point where you're like, oh, well, I'm going to close the door. You're going to have a treat. For a dog who's pretty orally likes to chew on things, something
Yeah.
like a frozen Kong with peanut
Mhm.
butter in it. If they're, if they like treats, they can work on that. Then you can open the door. If you're lucky, maybe they'll learn to fall asleep in there. So, but it's a gradual process. You can't, unfortunately, with animals, have forced them to do something they don't want, but we can
Yeah.
gradually shape their
Just like
behavior
a
if we
child.
make it rewarding.
Well, I know there were so many things I wanted to ask, and I've kept you so long, but I do want to ask you about companion animals. Do y'all work with them? Do you train them, or do you just what's your primary role with companion animals?
It's different terminology. So when I was in veterinary school, I was in the companion animal tract, which was cats, dogs, and horses. So we did
Oh.
everything and pocket pets, but we didn't do food animals. So that was kind of the first definition I thought of. So again, working with companion animals, in some cases, yes, it can be service animals, emotional support animals. So at least in terms of that, the requirements for working with them are a little bit different, but not actually. I have a funny story. So my first experience with dealing with a woman, she was visually impaired and she had a guide dog,
Mhm.
and she rode public transportation, and her dog had been having some stomach upset and some back issues. And so I had prescribed some medication for her, like so we could prescribe some pain meds, and then we took some x-rays. And so I was like, oh wait, we have to take x-rays and we can't sedate your dog. She's like, I have to get home. So, and I need my dog to be my eyes. So we had to kind of work with her and recognize that her service animal still needed to be of service while we were doing what we needed to do. So we made we got around giving, we're like, okay, well, instead of giving sedation, let's go ahead and we'll give some pain meds so that we can take x-rays and your dog is very calm, so we can get the x-rays that we need. And in the meantime, and maybe it was a mistake on my part, but not really, I gave her a muscle relaxant to give to her dog. So she gave her the muscle relaxant, and then she came back later and she said, so yeah, the muscle relaxant was great. I'm only going to do it at bedtime because my dog got super, super gassy and riding the bus, and it stunk.
Oh no.
So I was like, okay, important safety tip. Recognize that, this can be a thing that will happen, and that, again, this, as a service animal, we need them to function both, mentally, physically, but we also have to like help our neighbors and not necessarily gas them out either.
Oh my goodness. There are just so many different dogs and the way they serve. And then now I do have a question. I know you see a lot of special needs. What are their dogs? What are the primary special needs? Is all of that physical, or are there dogs that have mental, like, people have special needs?
Yeah. We had a greyhound, and I'm pretty sure he was on the spectrum. So that's just me.
Okay. Well, my. Well,
he kind of had all the dog language messed up, and it took him about, I'm not sure that he ever actually learned his name. But
now, when you say on the spectrum, you mean he was like really on the spectrum?
Well, it was more that he was a little kind of, if you have someone who's a little on the autism spectrum, again, he just didn't quite emotionally click in with everybody else. So that was confusing for people, because they're like, your dog is like, he ran over to say hi and then he stood there. And I'm like, yeah, you're supposed to now go over to him and pet him. So all of his social signals were wrong. So there's that aspect. But then there's also, we will see some, not as often, but, there's definitely different intelligence levels of dogs.
Really?
There's,
which dogs is that breed specific?
A lot of times it can be. So like, you get those Australian Shepherds that will have a vocabulary of 50. And then again, you'll have my dog who the only word he knew was go, which meant go for a ride, go for a walk, go outside.
So you're saying but you're saying an Australian Shepherd is an exceptionally smart breed?
And they need to be kept busy, and they need a job, or
because they're going to actually, I've seen them at the dog parks. They heard every other dog. So what other dogs? Yeah,
they will hurt children.
What other dogs are smart, and maybe what are some that aren't so smart?
Well, so it's funny because I had a very smart dachshund, but she was super stubborn. So it was also very hard to tell whether she was just being smarter than I was because she was being stubborn. There are definitely some animals where you're like, the smart ones are not necessarily always the best ones to have, because again, sometimes they add in those layers of being stubborn or being smarter than you are, or trying to manipulate you because, they can. Poodles are also known for being very smart. There are some dogs where, and it depends, because I think there are some dogs where they're perfect for the people that like love a dog. So, there are some dogs where I'm like, some of those are just the dogs where they're like, I don't care. You could hit me with like, I've run into it. I mean, I've had those dogs where I had to do sutures because the dog ran into the car that was parked. So, there, some of them are not really that smart.
Well,
and again, it can vary among breeds. It sometimes is just like the more fun they're having, they got less of their brain engaged.
Well, and then I want to end, because you've given me so much of your time, but I do have to end asking you about dermatology. Is that something that many dogs need? And what's the biggest dermatological issue that maybe a dog would have?
Okay, so I have never lived in Alabama. Well, actually, I lied. I lived in Alabama from when I was 6 months old until I was 3. And at the time, I was not aware of that. But I know you guys have lots of fleas.
Is that a dermatological issue?
Yes, it is. You get fleas. That's definitely a derma, especially once it starts getting into, if an animal is getting hot spots, if they're getting bacterial infections, if they are getting, if they're allergic to the flea bites. So they're not necessarily allergic to the fleas themselves, but every time they get bit by a flea, think of
Mhm.
that flea as injecting a little bit of flea saliva, and they're allergic to the flea saliva. And then, they can get one flea that bites them, and then the whole dog is red and itchy and a complete mess and keeping
Oh.
you awake at night. So yeah, in some cases, yeah, that's definitely a dermatological thing that is super common all over the United
Okay.
States.
Okay. I guess I was thinking beyond, because most common vets could address those issues. Is that right?
Yes.
Well,
So
what
then,
is your
but then they
best?
have they have allergies too. So a lot of dogs will have allergies. So there will be something in the environment. So you may have, let's see, I'm looking at the trees in the back of my picture that have nothing good there, but let's say they're allergic to willows. Let's say they're allergic to pine trees. You can't take the pine trees out of your yard, and they're allergic to the pollen. And so that ends up becoming something that someone will see, a dermatologist for, or they just have like
Uh-huh.
the red itchy dog and they don't understand, or the red and, the dog who's constantly rubbing their face and is just,
Mhm.
super, super itchy. So that's when they
Can
go see a dermatologist.
Okay, and then I promise I'm winding this down, but I do have two more
No
questions.
worries.
Can a dog be albino? My golden doodle is solid white, and his eyes, when they're not dilated, they're like clear. And his nose is a light brown. And I've just wondered, is that albinism?
There can be, yeah. I mean, there can be. I mean, there can be in any species. There certainly are in
Mhm.
horses, and
Oh,
you know,
okay.
they tend not to. Many of them don't. It can be a lethal type of thing, so they don't live very long. But there can be. It would be highly, highly, very rare. And again, there may be more genetics, almost like a person who's very blonde, who
Oh,
has very
yeah.
pale skin, but
Yeah.
they're not an albino. So
Oh,
albinos
okay.
typically have, the red eyes.
Right.
So it's not just that they're white, it's that they're red. A lot of them can have some deafness that's included, and they can have some other kind of physical challenges as well. But yeah, there theoretically could be, though again,
Yeah.
most of the time you wouldn't see them very often.
Well, last question, because this is
Mhm.
something that, and I had the vet at Auburn that had to walk me through putting my precious dog down. But he said this, and then my local vet said this. I want to see if you agree that
Okay.
grain free is not good for dogs, that it can lead to, I believe, diabetes, possibly heart condition.
Actually,
What's
yeah,
your
yeah.
stance on grain free dog food?
Yeah, my stance is I mean, there still needs to be some research that's done,
Mhm.
but the indications are it's probably not the best way to go. My other, and I tend to even in my regular life, it's kind of that everything in moderation.
Mhm.
And when you talk to nutritionists, they say you need a little bit of everything.
Mhm.
And so there was a premise that grain free would be anti inflammatory. To be honest, I have not actually figured out where that came from in terms of who said that would be a good idea and where that arose from, whether it was actually from a veterinarian, or where they got their research, and whether it was actually research that they did in animals, or whether someone had taken some information from like another species and then transferred it to animals. So I have to, I'm the first person to say I don't know on that part, but from the data that's come out, it seems like there's a very, very strong correlation between grain free and certainly the heart conditions and things like that that appear in have appeared in certain dogs, certain breeds of dogs, where they were perfectly healthy, and then they're not a breed that's known for getting these particular heart issues, and then all of a sudden it's showing up. So
Mhm.
it still needs to be studied, but I think, again, like most things, it's better not to just do one thing in the diet. It's better to kind of have a mix of things in the diet.
Right, right. Well, do you have anything that you would like to say to the viewers or listeners who have and love their pets, and just from all that you've seen and all that you know, is there anything you would like to share that might be helpful or
Yeah.
interesting or inspiring? Maybe a story that has inspired you with one of your patients?
I have to say, certainly one of the things that we see is like those older guys. And I think it's super important just to kind of say, we will see a lot of older patients, and the oldest we saw was 19. So your friend has us beat by a long shot. but on the other hand, I think that for me, allowing your animal to age gracefully is super important. And also talking with your veterinarian about, I guess one of the biggest things is don't be afraid to give pain meds. A lot of times people will say, well, it's going to affect their kidney or their liver. And so it's a balancing act. Okay, if your dog is maybe only going to live 9 months anyway, and if the accumulative effects of, say, liver disease take 5 years to get there, there's no reason on earth that they shouldn't have adequate pain control. So, and in some of the things where the concerns where, oh, well, this is going to cause this issue. So certain, and again, I have to verify if this is true, but I'd had a orthopedic surgeon who had said that some of the labeling where it said that certain pain meds would cause kidney issues was actually something that they transferred over from human medicine, and it's never been shown to be really true in dogs. Unless, there were concerns, maybe if your dog isn't drinking, and if you're still giving the pills and your dog is not feeling well and they're not eating, then potentially you could cause some kidney problems. But just by virtue of giving the medication, that was a human thing that they transferred over to dogs, and it's never been shown. So I think that there's absolutely no reason why an animal should not, as they get into their twilight years, experience the benefits of pain meds. You're not going to prevent anything from happening. If it does, we deal with it. You talk to your veterinarian, stay in close contact. But, there's too many, I think oftentimes those concerns about maybe triggering something that would never happen anyway. So if an animal's life, again, is only going to be a couple years, if it's something that doesn't show up for 5 years and they're only going to conceivably live to be 15 years old and it wouldn't show up until they were 19 and they're not likely to hit 19, there's no reason to prevent them from, experiencing a better quality of life and being able to interact with family. Because most of them, that's what not all of them, but most of them really want to interact with their family, and they want to continue to be an important member of the family. And so just allowing them to have, their best life, I think is super, super important.
Well, I just think what you do is wonderful and it's fascinating, and y'all should start a TV series documenting all these things, because it's just so fascinating that there's so much that you can do for animals beyond the typical veterinary practice. But I am just so grateful that you are here today, and I will link on the show notes to Scout's house.
Oh, please do. Yes, definitely.
Also, where else can, and I will put it on the show notes. I know you all have a Facebook, Scout's house. Do you have any other social media channel or way that people can find you, your website?
Yeah, the website. So basically those two, we're a pretty small operation. So there just isn't time in the day when we're taking care of all the animals.
I know. It's how do you set all that up? Yeah, I understand. Exactly. But thank you so much, Leigh. My best to your family, and maybe you could come back again when there are new breakthroughs and taking care of our loved ones.
I'd love to, and I'd love to meet you sometime. And, since my husband has already met you face to face, but I would love to meet both you and Zane as well.
We would love that. If we come to California, we will come visit, or at least drop by.
Please do. Please do.
We will. Well, thank you, Leigh. You have a blessed day.
Yes, you too. Take care. Bye-bye. Okay.